lecture, I'm going to be talking a little bit about using logic models to plan your public health intervention. So I've talked before a little bit about some of the ideas around public health interventions and how we think about making them more effective. Well, here I'm really thinking about strategically and practically, how do you actually make it happen? I know that this is important to you all because you're interested in public health, and ultimately public health is all about doing things in the real world to improve health for folks. And this is some tools for you to think about, okay, if I want to do something, how do I actually do it well? All right. So first off, what are logic models? So logic models are essentially what they sound like. They're models that help you to logically go through the process of thinking about, okay, if I want to do something for health, what are the steps I go through to sort of make that actually work? So there's a whole bunch of them out there, Proceed, the Kellogg model, Perry, Wisconsin model. There's a whole bunch of different CDC models of various sorts. The one I'm going to be focusing on here is called MapIt. Now, it's not to say that the other models aren't useful. Some of them are actually quite elaborate and help you think about a whole bunch of different things. But I really like MapIt because it's fairly simple and it actually addresses things in a certain way that I tend to like quite a bit. So for MapIt, I should first say where it comes from. So MapIt is from Healthy People 2020. And again, Healthy People 2020 is the essentially the goals for the United States around what we can do to address a wide range of different health challenges that we're facing. And this is a very large document. If you actually go into it, there's hundreds and hundreds of pages where they set goals and objectives for all sorts of different health conditions, all sorts of different problems that affect different communities. It's a very complex and interesting document to sort of think about, okay, if we want to have goals and ambitions for improving health in our country, what are we going to address to do that? So they brought in people from all over the country to make this. And as they were thinking about this, they were trying to consider, okay, if we're going to say what these goals are, what do we recommend in terms of a process for helping communities to actually do something about these suggested goals? So what they did is they put together what they call the MapIt planning model. So what is the MapIt model? Well, it's a model that's made up of 5 different steps, and it's composed of mobilize, assess, plan, implement, and track. Okay. So what is mobilization? It's essentially the idea of reaching out to your stakeholders, reaching out to members of the community, and engaging them in the process to think about, okay, given the problems that this community is facing, what do you actually want to work on? Assessment is where you try and bring in together data and preferences and needs of communities and come up with priorities for what you want to do in that situation. You can then move on to the planning stage. And the planning stage is where you say, all right, we have this thing that we want to work on. How actually are we going to do this? What is our plan for implementing this? And then once you have that plan in place, then you can start actually doing your intervention, and that's the implementation phase. So you'll be moving forward with it, but you want to have a discrete strategy with clear information, so everybody knows who's doing what, etc. So that's a stage that really helps to make things run smoothly. And then there's a tracking phase. Now, you actually want to be collecting information throughout this entire process, but tracking is the idea that you want to be collecting information to be able to say what's working and what isn't about this intervention. Are we actually making a difference? Are there things that we're doing really well, or are there things that maybe we could improve? So it's allowing for you to go through a process of continual improvement and actually to be able to show outcomes from what you've done. So why do I teach MapIt? Why do I think that it's important to use this approach? Well, I've talked before about some of the things that we know about public health interventions and why they don't work. And a lot of those issues come down to efficiencies and effectiveness type questions, and also ways in which you can actually take that intervention and transfer it to other settings and use it very easily. So I think that those are really important elements to this. But what I will say is that I think that one of the biggest problems with public health interventions is a general failure to really take into account the communities that you're wanting to work with. So a big problem that often occurs and has occurred historically is that some people in public health decide that something would be really great for a community to do. They figure out what their plan is, and then they show up at the community and say, here's what we're going to do. And the community hasn't had any say in that matter. They haven't really, their needs or preferences haven't been considered, right? And it doesn't work because these plans actually rely on community buy-in, on community participation, right? So this hierarchical approach really just doesn't work very well. And it isn't very empowering for building a movement towards improving health for that community. So there's some real advantages to MAP-IT, and that's partially around the idea that it really mobilizes people first. So it really aims to involve all the different stakeholders who would be interested in this particular health-related issue. Or perhaps you're bringing together stakeholders and you're not assuming to begin with what the health-related issue is that they want to work with. You as a public health worker might have your own ideas, but maybe the members of the community actually know something that you don't that is much more important and more interesting to them. The other thing about the assessment and the way the assessment is structured is that it ensures that that assessment occurs with that community, that it isn't something that's imposed from outside, that uses data that may or may not be relevant to that specific community. And the other thing that I like about this approach is that it really focuses in a bit on talking about assets of a community. So a lot of public health approaches say, here's something that's wrong with your community. Here's a problem. We're going to solve your problems. In an asset-based approach, you also consider what are the strengths of the community? Why is this community powerful? How can we support that community and see them as being a thriving, vibrant community, right? Instead of this sort of poverty or illness-centered mentality, how can we create a positive frame where we can say, look, we're a community that has these wonderful things. We have some challenges that we want to work on together. How can we do that together? And that creates a much more powerful approach to addressing a public health issue. All right. So the other advantage to this is that it has a distinct approach for planning, right? So we all know when we try and do things that there's challenges in keeping everything in your head and figuring out where you're going, figuring out what your objectives are, staying on track. That's a hard thing for anybody to do. It's a hard thing for me to do. And what these logic models do is they give you a distinct structure that you really work through to make sure that you actually are hitting all the key points that you need to make an intervention work. And that actually tends to be really helpful in terms of actually achieving what you're trying to do. The other thing that I think is really important about this plan is that even though tracking is the last step, it does include collecting information from the very, very beginning of a study, right? That's important because if you do intervention and at the end you say, well, look, we did all these things, if you haven't collected data throughout that entire process, you can't show that there's actually any change based upon what you did, right? You want to be able to show that you had a problem before, you did all of these interventions, and then afterwards, you actually have benefits, because that's important. So it's important to show to the community. That's also important to show to people who might be funding these types of efforts in the future. So having that data collection throughout the process is an important component to this intervention, this logic model structure. All right, so let's go through using the MAP-IT approach. And we'll start off with mobilizing. So what do you want to do to mobilize a community? Well, you want to sit down and think carefully about, okay, who should be at the table here? Who am I going to be talking to? Who am I going to be working with? Brainstorming different potential partners. And it's important to do this in a thoughtful way, because there might be some people you wouldn't normally think of who might actually be really quite interested in this. Then you start recruiting people who you think would be the key folks who would want to be involved in this and who actually could play an important role in this potential project. And then you want to create some sort of vision which is aspirational for that coalition, that group of people who want to work on this project, and work with them to make that happen, to make that vision be something that people are happy with. Then you go into the assessment phase. So the assessment phase, what you're trying to do is collect information which that gives you information about sort of local resources and needs, and also that integrates some larger information from other national sources, for example. You can also look at archives to get this information. There's all sorts of different sources that you can use to pull this information together about the health-related problems for this community. You also want to, at the same time, be talking to those community members and really think about what, when you look at all this data, when you talk to community members, what are the things that they're really passionate about addressing in terms of health-related needs? You also want to address those community assets, which I talked about earlier. The idea that we want to think about who are the people who can put effort into this? What are our capacities, and how can we look at things that we can do to improve those capacities, to build those capacities for our communities, to make our community even stronger? What are the organizations and institutions, religious or hospitals or other groups? Do we have people who are excited about this who have specific skills? Somebody who knows how to design a website is really important. People who are really good at talking to people are really important. And then you also want to think about how you're going to fund this. What are the resources that are available? Who might want to step forward with that? And how can we pool those funds to actually make this happen? There's a whole bunch of different things you can think about in this sense, but really thinking about what are the things that we have that we can put into this together. Once you've talked about this a bit, you want to then start making some priorities about what you want to achieve moving forward, right? So what are the health-related problems that you see as being most important? And as you're doing this, once you have this idea, you want to establish some baseline data. So if your problem is cardiovascular disease in the community, you want to know how many cases are there. You might want to know a little bit about what the risk factors are for it that are present in your community. You want to know a little bit about what people's behaviors are before your intervention, right? So there you have some baseline data, and baseline means data that you have from the very start that you can compare future data to. All right, then you want to go on to planning, and that's where once you've chosen that initiative, that project that you want to work on, you need to start creating some objectives, right? You want the objectives so that you know where you're going, right? You won't know whether you've succeeded at achieving what you're looking for unless you actually have clear objectives that you're trying to reach. So for each of those objectives, you want to have a plan or a strategy that you can adopt to actually accomplish that objective, right? So you want to think about what the appropriate approach is. So if you're thinking about, again, cardiovascular disease, do you really want to focus on diet? Do you want to focus on exercise? Do you want to focus on changing the way that restaurants provide food? There's a whole range of different things that you could potentially address. And based upon your objectives and research, you can come to an idea of what's likely to actually be most effective in achieving that goal, right? You also want to have a timeline, right? So you want to figure out, if we're going to do this, if we're going to take this strategy, what is a reasonable approach for actually making it happen? What is the timeline in which we think that's going to happen? And having it be reasonable is important, because you don't want to set this really strict, optimistic timeline and then not meet it, right? You need to figure out what people can actually reasonably achieve. And that's going to help you figure out allocation of resources, for example, among other things. You also want to have a clear plan for who's going to be doing what, right? It's very hard when nobody really knows who's doing what. You've all seen this in various projects that you've worked on, where it's unclear who's in charge of different things, and sometimes you have duplication of effort, or something just falls through the cracks. If you have a clear plan, which is all laid out and written down in terms of who's going to do what, that puts you a big step ahead. And then you want to actually look for different indicators or measures of progress. So what this means is actually having a clear idea of how would you actually tell if you're actually making change. So if your change is that you want to get people to exercise to decrease risk for cardiovascular disease, well, your index might indicator might be how many hours of exercise do people do, or what are people's attitudes towards exercise, or do families exercise together, or how many gyms are there in a region. Different types of things that could potentially be indicators of whether you've been able to move the dial a little bit on this health-related issue. All right, then you have implementation. So implementation is where you take that plan and you actually start running it. Something that's really helpful here is having a clear central point. So you have somebody or some organization that's in charge of making sure that everything's happening and keeping the communication going between different groups, right? When you don't have somebody who's really responsible for that, the diffusion of responsibility sometimes can make for some pretty challenging situations. And again, things can fall through the cracks. Having that communication be clear and engaged is also really important. So having people know what you're doing, what your organization is doing, what other organizations is doing, is going to help them to focus in on the things that they need to do so they're not stressed, and make sure that there's coordination between them. The other thing is at this point, because you're actually doing it, you want to be starting to exercise your plans for how to communicate with the media. So let the community know that you're doing this thing, that you're creating this exercise plan, that you want everybody to be excited, that you want people to come out to your meetings or whatever it happens to be that you're working with people on. So as you're going through this, and also as you finish up these campaigns, you want to be doing tracking of how things are going. So you want, from the very beginning of this process, as I mentioned, for collecting baseline data, you want to be collecting information. You want to be seeing whether or not what you're doing is actually making a difference and changing these indicators for different health-related factors that you're interested in, right? So to do this, you need to have a clear system for gathering that data, right? And put it in place, make sure it's reliable. So there's some things in this that you want to consider. So think about data quality. How can you set this up so that the information you get is good, that people would trust it if they saw it, right? Think about there are some limitations to data that's self-report. So are you only going to look at things like how much exercise people say that they do? Or are you going to look at other factors as well? The amount of exercise that people say that they do might be substantially more than they actually do. So that's a factor that you consider. Data validity and reliability. How strong is that data? You also want to consider what data is available. So you can, some data is pretty hard to get, other data isn't. Some of that hard to get data, if you plan properly and you talk to the right people, you might be able to get it from the very beginning. But if you don't think about it, well, then it becomes much more of a challenge. So considering what you can get is important from the very beginning. Another thing is as you're going through this, I think the tracking process allows you to share with your progress and your successes with community members. So you're able to say, well, when we started this program, only 14% of people exercise regularly. Now that's up to 25%. And that's actually a pretty big difference when you think about large groups of people. That makes a big difference for health-related outcomes across a wide range of different conditions. So being able to share that, being able to show people that there is that this is making a difference can build excitement about it. It also makes a difference in terms of gathering those resources. So people who are funding this or organizations are funding this, they really want to see that something is being done and that you're making a difference. And this data, this tracking component is really crucial to this. If you go through a public health program and an intervention and you don't have the data to show that you did something, well, it may just disappear, right? So it's really to your advantage to have good data that you can show people this made a difference. And not only should you keep on funding me, well, maybe other places around the state should start adopting this strategy, and we'll help you to do that. And we'll keep on moving things forward and helping people improve their health. All right. So that's logic models in a nutshell. I talked about there's a whole range of different ones. The models are there really to help you to systematically go through the process of coming up with an initial idea within a community to actually implementing that and using that information and showing that you made a difference. So by following those different steps, you're much more likely to produce an effective intervention. And I think that you'll find it will make your life a whole lot easier. All right, so thanks for listening, and we'll talk more about this later.